Thank you for the invitation to be here. So as Craig says, I'm based in the RCSI, and we are, people when they hear about us, they kind of hear the word surgeons, but essentially we're a health sciences university, and we're based in 4 campuses here in Dublin, in Bahrain, and then 2 medical schools in Malaysia. So we take students from 68 countries around the world and train them in medicine, physiotherapy, pharmacy, and so on. And that's all we do. We're exclusively healthcare. And in 2020, we set up a new Centre for Positive Psychology and Health. And what I'm going to do is try to set the context for that. Why would an organization like ours that was set up in 1784, that's a very long tradition in medicine and surgery, why would we now, as a scientific organization and a medical education organization, start moving into this kind of space? And what I'll be emphasizing throughout this is the importance of the scientific foundation of looking at these kinds of areas. Because when you go out onto the internet and you start looking at wellness and well-being and so on, you'll find there's a great deal of material out there that really is not supported by any research. So it becomes important for those of us in the medical schools and the medical universities to start looking at what the evidence is and sharing that with the public. So this talk follows on very well from Finbar and Caroline, that I wanted to start going out into the community and start looking more at the concept of health. And I think it comes as a surprise to people when they look back to see what the original definition of health is in the WHO establishment documents. And WHO defines health as a state of complete physical, mental, and social well-being. And here's the important part, not merely the absence of disease or infirmity. So most of us tend to think about our health in terms of, well, if we're not sick, we're healthy. But that's not what the definition says. The definition says that there's a lot more to being healthy than just not being sick or not being ill. So you could from that argue that what we have in Ireland is not so much a health service, but we have a disease service, because what happens is people get sick and they go to the service and the service looks after them, gets them back, hopefully, to not being ill. But there's a great deal more to being healthy than not being ill. And this concept, this way of thinking about this is sort of gathering a lot of momentum now. So if you think about your normal health, and I'm showing that here, here's where the current health service really operates, and the kinds of drugs and therapeutic interventions that Finbar and Carl are talking about are really focused here. So this is pathogenic. This is really about the origins of disease. So we've signs, symptoms, disability, premature death, and so on. And the whole system is designed to get us to here. But then emerging is huge interest in what we call salutogenesis, and that is the genesis of well-being or health, complete well-being. And there's a whole science now emerging asking the question, how do we move people up to this end of the spectrum? And we'll talk in a moment about lifestyle medicine and positive psychology in that context. So that's the first big kind of idea, that health is much more, it's much broader concept than just the absence of illness or disease. And traditionally, treatment has sort of focused down here, whereas this new way of thinking, yes, it's saying we've got to take patients and bring them right, but we've got to bring everybody up in terms of their health and well-being. Now, when we look out there at the incidence and prevalence of disease, particularly what we call the non-communicable diseases, the diseases that we don't get from infections, the situation is really, it's devastating, really, if you think about it. 41 million people each year die from non-communicable diseases, and they account for 71% of all deaths worldwide. And if we take 5 conditions, that's diabetes, cardiovascular diseases, cancer, chronic respiratory lung diseases, and mental health problems, they account for 86% of the deaths and 77% of the disease burden. So it's not just about dying prematurely, it's about living years with a burden of disease. So in the European Union, European region, those 5 conditions account for the majority of deaths and most of the disease burden. The kinds of drugs we've been looking at, that's where the drugs are targeted to help people who have developed these kinds of conditions to manage their symptoms, to improve their quality of life, and so on. But the evidence is that 80% of heart disease, stroke, and type 2 diabetes, and 40% of cancer could be prevented primarily through improvements in diet and lifestyle. So this is a kind of a refocused way of thinking. The idea here is not so much to treat the condition when it happens, although of course that's terribly important. The idea here is that in addition to that, what we want to do in as much as possible to prevent the condition developing in the first place. And central to that is the individual. Central to that is each and every one of us. It's the idea of empowering us to manage our lifestyles in such a way that we don't develop these kinds of chronic conditions. And in medicine and nursing and so on up to now, that's really been the Cinderella side of intervention, prevention. But it's becoming more acute because we can't keep going the way we are, because as countries develop economically, the amount of non-communicable diseases increases as lifestyle changes, and also as populations age, we're seeing far greater numbers of people becoming chronically ill. So we're not going to be able to continue to cope with the kind of healthcare system that we have now. And we've seen even with COVID how, you know, not a lot is required to put huge pressure on our healthcare systems. Now, if we look at the picture in Ireland, this is from the HSE's Healthy Ireland report published about 2 weeks ago. You'll see that over 1 million of us currently have one or more chronic diseases. And that's a huge number. 49% of us have one chronic disease and 18% have more than one. And our rate of development of chronic diseases is increasing at about 4% per year. The most common diseases in Ireland are cancer, cardiovascular diseases, heart and blood vessel diseases, and respiratory or lung diseases. So it's a very, very sobering picture when you look at it in terms of these kinds of numbers. And a very nice report from McKinsey just last year looking at the economic consequences of chronic diseases for countries basically estimated that the payoff, the economic payoff for a country, never mind the humanitarian and the welfare payoff for individual patients, the economic payoff of prevention is absolutely huge in real terms, in real economic value. And to do that, this is why I think these kinds of seminars are very important. We've got to make health a social and economic priority. We've got to keep health on everyone's agenda. We really do need to transform our healthcare systems. And we need to double down on innovation and therapeutics. So it's not one or the other. It's really both. It's the kinds of things that we've heard about already this morning, plus a change in the way we think about prevention. And this kind of thinking has led to the emergence of two kinds of key specialties. One is lifestyle medicine, which is the application of environmental, behavioral, medical, and motivational principles, getting people to change their behaviors, to the management of lifestyle-related health problems in a clinical setting, including self-care and management. So we're now seeing emerging this specialty called lifestyle medicine. And it's very interesting that the big health insurance companies are starting to adopt this, because from their business model point of view, it makes sense. If you can prevent people getting sick for longer, your costs go down. Cost of maintenance and interventions, and so on. And here's a very nice quote from a paper by Katz back in 2013. Now, he said, an aggregation of evidence, basically from modern epidemiology, says that tobacco, poor diet, and lack of physical activity constitute the leading causes of chronic diseases. And then Katz goes on to say, and I think this is really nice, he says, conversely, the salutary use of feet, fork, and fingers. So that's something to remember. Feet for physical activity, fork for diet, and fingers for not smoking, not overusing alcohol and other drugs, could slash the risk of all chronic disease by 80%. Those kinds of lifestyle interventions. And it's more complex even than that, because we know that the genes that we're born with that contribute to these conditions, the expression of those genes, whether they become active or not, is also influenced by our lifestyles, either for negatively or positively. So it's possible to influence dangerous genes, if you like, by changing our lifestyles. Okay, so then we ask the question, well, what's psychology got to do with it? Because that's the second big arm of this. Well, the first is we're becoming much more aware of the complicated relationships. Brains and minds and bodies are not separate entities. They all work as one. We know non-communicable diseases are growing, but the risks are behaviors. So diet, lack of exercise, sleep, drug use, alcohol use, they're all behaviors. And psychology is the science of behavior. And then in addition, we know that mental health is emerging as a major challenge in the developed and developing world. So we've got to start figuring out, how do we improve the mental health of everybody, not just people with mental illness. So positive psychology then is a scientific discipline, and really important to emphasize that looks at the upside of the human condition, happiness and well-being. So we use the scientific method to explore and enhance the positive aspects of life. So it's the same kind of ideas we were talking about earlier with physical health, that the absence of mental illness, which is what we tend to treat here traditionally, is not the same as the presence of happiness and well-being. So yes, we're interested in positive psychology in people with mental illness, but we're interested in improving the lot of everybody. And if you ask the question, well, can that be done? Do you inherit your level of happiness? The evidence is you do. About 50% of your level of happiness is inherited, but you can influence that to about 40%. By 10% from your circumstances, and then 40% by how you live your life. Now, I don't have time to go through all of this, but you'll have it on the slides. When we talk about happiness, we're not just talking about feeling good, positive emotion. While that's important, engagement, doing activities that are interesting and absorbing for us is key. Relationships are key. Having a sense of meaning in what we do is key. And then having a sense of accomplishment, of achievement in what we do. And the evidence now from positive psychology, I just want to give you examples of these here, is that we can intervene ourselves as individuals in ways that increase our level of happiness across each of these 5 areas of happiness. So, for example, relationships, improving relationships to improve compassion and communication skills, meaning considering your values and goals and purposes, achieving true self-discipline, and so on. So really what I'm saying here is we have scientific evidence to show that interventions of this type actually significantly increase happiness and well-being. And if you want to follow up on this personally, the best website I think you can look at is the VIA Institute of Character in Cincinnati. Really good science behind this. It's an NGO. We know the researchers there. You can log on there and do a detailed questionnaire which lets you identify your strengths. And we tend very much to focus on our vulnerabilities and on our weaknesses. The evidence is that by finding out what your strengths are and focusing on those, that can significantly ramp up your sense of well-being. So there's an example of one well-validated, strong scientific evidence for the intervention that you can access immediately. Oh, and by the way, it's free. And for any of you who have children, there's a version of the scale for 10 to 17-year-olds, which really works very well, helping kids to identify their strengths. And this is important because not only are strengths and, kind of things like optimism related to our mental health, they're also related to our physical health. There's a huge study published last year in the Journal of the American Medical Association showing a link between optimism and cardiovascular disease and all-cause mortality. And in a nutshell, basically the evidence is that optimistic people don't develop cardiovascular disease to the same extent as pessimists, and they live longer. Why is that important? We can teach people to be optimistic. Even pessimists can learn to change their mindsets to become more optimistic. Final 2 points I want to make here is when we start to look at the linkages between our brains and our bodies, one of the linkages we're very interested in is something called metaflammation. And that is this low-grade type of inflammation that was discovered in the mid-90s. That's quite different from this kind of inflammation you get here when you get a virus or a bacterium. This is a type of inflammation that goes along at a low level but causes damage. And it's triggered by stress, it's triggered by diet, it's triggered by lack of physical activity. So we're starting to learn now what are the mechanisms that translate these kinds of lifestyle factors into disease. There are fascinating research. Major centre in Cork, Ted Dinan and John Prine, is linking what happens in our gut to what's happening in our brain. And there's some fascinating research emerging there about how our guts produce the kinds of chemicals that our brain needs to function normally. So that's all I'm going to say about that. Anybody who's interested in following up further on this, if you go to the RCSI website, we've a Science of Health and Happiness program there that's free. It's 10 lectures. 35,000 people have registered for that as we speak. We have a Science of Health and Happiness program for young people. And then we also have the RCSI My Health series, where we explore a lot of these relationships. My final takeaway is that this is really about changing the way we see things, I think. Marcel Proust said that the only real voyage of discovery consists not in seeking new landscapes, but in having new eyes. So we're not saying that we move away from therapeutics and drug development, biotechnological development. We're saying that in addition to those, we start to really focus on preventive health and helping people to improve their lifestyles. So thanks very much. I'll stop sharing there, Craig.